to become a radiology tech? Was there something specific that got you interested? I decided to become a radiology tech after I went to school for health science. After that, I started to look into what careers that could lead me to, and I had a friend that poured me in this direction, and I have loved it so far.
When I was in middle school, I was always intrigued about the human anatomy. I saw like an X-ray picture one time on TV. I was like, oh, what is that? So I was always like kind of curious about it.
My grandmother is a retired critical care nurse. She told me to go into radiography. I followed her advice, went straight into radiography school, did my advanced imaging modality rotation, and fell in love with MRI and moved straight into MRI as fastly as I could.
I always knew that I wanted to work in healthcare. One of my friends, her older sister was an X-ray tech. She let me shadow her at work. So when I was in high school, I actually had the opportunity to take classes at my local high school that allowed us to come to the local hospital and do clinicals, and we would go through various different departments and just kind of learn about them. But as soon as I walked into a radiology department, I knew I was at home, so I said, I don't want to go anywhere else. I'm staying here, and I've been here since then, 17 years later. Explain some of the educational pathways one can take to work in radiology or imaging. Most schools have a program that a partnership with hospitals that allow you to go in and get your feet wet in different departments of the hospital.
The radiography degree program is a 2-year associate's degree. If you're very curious about it, you can probably shadow.
You can go into something a little bit beyond just radiology tech, and you can do MRI, CT, mammography,
nuclear medicine, interventional radiology, radiation therapy. You can do on-the-job training, or you can go to school for it.
And all of these things just take about a year or so. Usually it's an online course. You can start working on them.
You never have a chance to get bored because there's always something else that you can do or move on to.
I decided to be a student tech or a radiology technologist associate. So I was actually right here at Atrium Health Carolina's Medical Center, in one of the same places that I had some of my clinicals and that I work at now. I got to come to work, help the techs out, and it gave me a lot of hands-on knowledge and practice doing what they do.
What's a normal day like for you at work? Do you do the same things every day, or does it change a lot?
When you work in an acute care facility, every single patient is different. So while you may be doing the same types of exams, it's very interesting because everything is different.
So I'm going around with this very big and loud X-ray machine, and so people can hear me before they can see me. And I just go around people's rooms and just take pictures. So like be chest X-ray.
We are involved with all departments. We go to the OR, we do surgeries, we go to the ER, we deal with trauma and injuries. I do all of the fluoroscopy exams here at Cape Fear. I do a lot of the same exams, but every single patient is different, so the outcome is different nearly every time.
What kinds of machines or equipment do you use the most? Is there one you like working with the best? So we use a little bit of a lot. We use Shimatsu, we use Konica, we use big C-arms in the OR, we use portables, and these are all things that you probably learn about in school.
Most people recognize CT as it looks like a big donut and it has a table that passes through the donut hole, if you will. With CT, you get to see a lot of action from the ER, a lot of trauma, a lot of injuries. CT plays an active role in diagnosing as well. We do a lot of scans for our cancer center here.
The scanner I prefer working on is called the ERA. That's the model. And I prefer that one because it has the more advanced imaging techniques on it. We have special sequences that we utilize for kind of state-of-the-art, cutting-edge scans. We're involved heavily in research and cardiovascular studies that scanner is specifically suited for.
What do you think are the most important skills or traits for someone in your job? It requires somebody with high energy, somebody who's quick on their feet, someone who's adaptable. You just have to be prepared to be able to go with the flow, but also understand that it can take a sharp turn and you can follow right with it. Definitely compassion and empathy, just like any job you work in healthcare.
We're working with people. So at the end of the day, they're in the hospital or they're at the doctor's office and they don't feel good. So you really have to be compassionate.
And just be mindful of people's and what their experiences, what they're going through.
You also need to be able to critically think. Think, how can I obtain what I need while meeting the patient's needs as well? Not every patient is going to be able to perform a textbook exam. So what do you have to do to think outside the box?
There's a lot of on-the-spot thinking.
Physical strength is actually very important because we are handling patients, moving them from their stretchers to the tables. We have to put our detectors underneath them when they can't move. We have to be able to hold up patients and move all of our equipment around.
Can you tell me about a time when your work really made a difference for a patient? Our work makes difference for patients every day. For example, in fluoroscopy, we do a lot lumbar puncture chemo administrations. So those people already know they have cancer and they're there to be treated. So you really have to treat them with a lot of kindness and kind of read the room a little bit and be whatever they need.
Most of the time, you bring a small child into a CT room and they've got this big machine, like I mentioned earlier, it looks like a big donut and it's a little intimidating. So one of the things I like to do is let them touch it. So I'll tell them, I need you to turn my machine on. So a lot of times I'll pick them up and they'll let them push that button and they think they've turned the machine on because the light comes on. So once they've made that connection that nothing's going to happen to them and that they can actually be in control of this big machine and make something happen, it really kind of takes their nervousness down and allows them to relax a little bit.
So I make sure to slow down, explain what I'm doing, ask the patient if they have any questions or maybe what they're concerned about, and see if I can make it better from there.
Try to give them music. We also employ aromatherapy in MRI.
And this is where your interpersonal skills come into play, say, hey, I understand that this is not what you want, or I understand this is something that causes you some type of anxiety, but it's very important that we get this done. This is based on what the doctor has said, and we want you to get better. And 9 times out of 10, the patients end up understanding.
How do you think technology is changing in this field? Are there any cool new tools or techniques coming out?
We have some of the most cutting-edge scans in the world. We perform cardiac MRI exams that are put up on a world stage with Sanger Heart and Vascular. We perform what's called diffusion-weighted whole-body imaging, which can take the place of a PET scan.
In the 17 years that I have been in radiology, have moved from taking images on film to computed radiology to digital radiology. I mean, I'll be honest with you, there's no telling 10 years from now how we'll be able to obtain images and diagnose different things for people.
We use DR technology now, so you can see it right away. That helps reduce the dose of radiation to the patient.
I did see some DDR coming out, and those are like x-rays, but they moved. It was kind of like a live photo on an iPhone, but with an x-ray, and I thought that was really cool.
As a thing in the future, I believe things are gonna be more hands-free. There's a room downstairs in the ED. It's a Samsung model of the room like this, and everything, you just press certain buttons and it just pretty much does everything you want to do.
We have a new interventional radiology program here, so now we're being able to take patients who would have to go all the way to the OR and be put to sleep and have an invasive surgical procedure. We've been able to just bring them into the radiology department, give them just some minor sedation, and they can go walk in, have this test done, and walk right back out an hour later.
What advice would you give someone like me who's thinking about becoming a CT tech?
Just do it. Don't hesitate. You're gonna love it. I eat, sleep, and breathe radiology, and I can't express enough how much I have really enjoyed my career.
Definitely do your research. Make sure it's something you want to get into. Try to shadow people if you're able to.
You have to be intelligent, both mentally and emotionally. Always keep in mind that people are counting on you, and not just the patients, but your coworkers.
I definitely say go for it. It opens up so many opportunities. So I say just study, keep going, know that the end result is worth it.